And we welcome back Dr. Paul Byers, State Epidemiologist. Let's talk about West Nile now. What exactly is West Nile?
Well, West Nile is a mosquito-borne viral infection as well, so it's transmitted through the bite of an infected mosquito. It can cause an illness of fever, sometimes a rash, certainly a headache. Most people have relatively mild symptoms, flu-like illness, but in some cases it can cause a more devastating neuroinvasive disease with encephalitis and meningitis, sometimes a paralysis, and the recovery time can be very prolonged in those cases. Unfortunately, it can lead to deaths as well.
Well, seems to be such a wide spectrum of a mild flu-like illness up to death. What's the difference there? Is it the difference in the type of mosquito that bites you, or is it a difference in your condition already as a human?
We see it more as age a predictor of those folks who are going to have more significant complications from West Nile. Those folks with neuroinvasive disease, their risk is increased in people over the age of 50, actually, and that's where we see most of our West Nile encephalitis and meningitis.
West Nile's been around a lot longer than Zika in Mississippi. What, 15 years ago was the first case
2001
here?
Was our first human case in Mississippi.
And how serious is it of a threat still today in Mississippi?
Well, it doesn't look like it's going away anytime soon. Certainly we have some variability from year to year on the number of cases that we have. And this year has been relatively mild when we look at previous years and the number of cases. But, you know, the big deal is that West Nile is around, it's here, it's in our Mississippi mosquitoes, and it can lead to some devastating illness and in some cases deaths.
The mosquitoes that carry it, where did they get it?
Yeah, that's a great question too. We think that West Nile first came into New York, but then rapidly spread across the United States. And this particular virus is maintained in a mosquito-bird cycle. So the way the virus is transmitted is from an infected mosquito who bites a bird who becomes infected, and then that infected bird is then bitten by an uninfected mosquito, and we just are kind of an accidental or incidental infection. And when people get infected, mosquitoes don't get infected from us, but it does occur. So this is mainly in mosquitoes and birds, and we are just kind of an incidental infection.
Well, the mosquitoes that do have it, is it just one type of mosquito like we see with Zika, or can any Mississippi mosquitoes potentially be
This is the southern house mosquito. This is a mosquito that likes to breed very closely to our houses, and it can do it in very small collections of water, especially that have a lot of leaf litter in them or organic matter, like a backed up gutter or a flower pot that's overturned. Those are the prime areas where this mosquito breeds. So it's around our house.
And it has been around for those 15 years.
Yeah.
Zika is a new thing. It seems to be grabbing all the headlines now. Is that at the expense of West Nile? Is West Nile a larger threat to us than Zika is?
Well, you know, West Nile is one of those things that we're all at risk of if we're outside and we're exposed to mosquitoes here in Mississippi. For Zika, you still need to travel to those areas where there's ongoing transmission to be at risk. So, yeah, this is something that Mississippians need to be aware of because we do have it here, and it's not going away, it doesn't look like, anytime soon.
Nor are mosquitoes. They're a fact of life in Mississippi. We've dealt with them all our lives, and as long as Mississippi's been here, it seems. So if they're so prevalent, and we've got two potentially deadly illnesses that they can transmit to us, how on earth do we protect ourselves?
Well, you know, you need to be looking around your house for areas that mosquitoes can breed. You need to get rid of those areas. You know, dump out that water, clean out those gutters, make sure that there's no places for the mosquitoes to breed. When you go outside, use mosquito repellent, especially for West Nile. If you go outside during the times of day when this mosquito is most active, in the cooler times, evening and early morning. And with this mosquito that transmits West Nile, we know that it can be year-round. Certainly in the summer is when we see most of our cases and most of our activity. But we have had infections reported to us as early as January and as late as December in Mississippi.
Thankfully, we have more people who are infected than we have a number of people who have died from this. The survivors, the people who survive West Nile, are there long-term effects that they suffer as a result of it?
Well, like I said, most people recover quickly without any long-term problems. But for those few folks who have the neuroinvasive form, it can be a prolonged recovery period.
And something that affects them for years,
It
for
can
months?
be. It certainly can be, especially those individuals who have paralysis or other movement problems as a result of the infection.
What about a vaccine for West Nile, a way to prevent it and a way to treat it?
You know, there's not looking like there's going to be a human vaccine for West Nile anytime soon. The best way to prevent it is those things that we talked about already. Certainly as far as treatment, it's still supportive care. So for those folks who think that they're ill with West Nile, we recommend that you see your doctor. For those people who have the more severe form of West Nile, certainly hospitalization is sometimes required.
How tricky is it to diagnose West Nile?
Well, it's a blood test, so it's relatively easy depending on the circumstances. And, you know, doctors can order that test relatively easy.
Can the test determine how severe a case one has of it?
No, it not necessarily. When we do test for the cerebral spinal fluid, that can give us an indication that it's neuroinvasive disease if it's positive, but it's not necessarily going to be a predictor for how severe the infection is going to be or how long the recovery is.
With Zika and West Nile both in the spotlight, you've been a busy man. I take it your ideal scenario was that you can disappear back into the lab and not have to face this again.
Well, and if we could convince folks and make them understand the dangers of traveling to those areas where there's ongoing transmission, especially for pregnant women or women who are planning to become pregnant when we talk about Zika virus.
Very good. Dr. Paul Byers, State Epidemiologist, thank you for your time.